Yeah. Samsung, is this Mickey?
No, this is Angie.
Angie. Okay.
I had to sign up on my phone and I don't know what it did.
Go to the back because the student just came in, so let me go start the thing. Make myself here. Okay. Angie, can you hear us?
Yep, I can hear you. How are you guys doing?
Good, good. I don't know if Dave's gonna come in. I guess it's probably.
How are you guys doing today?
Good, how are you?
Good. Did it rain over by the track in the last 24 hours?
Yeah, it's pretty bad overnight.
Yeah. Now the
I
big question is, are we going to be on or off the turf?
We're always off the turf.
Really? Because last week we were not off the turf and we should have been.
Well, that sounds like a good thing, doesn't it? I don't know.
It depends if you're a main track only, and I have a main track only in.
Oh, okay. How
And
many
I'm
horses?
not in town, so I have to like boogie on home if he's gonna get in, so on Sunday.
How many horses does your dad have here?
I think 5 or 6.
Dave's coming. Good morning, Angie.
Good morning. How are you guys?
Good. How are you?
Getting along, causing trouble,
Will we
but just
see?
enough.
I yeah, I would expect nothing less. Will we see you on Monday?
Yes,
Great.
that is on the plan. Now the big question was, what time does it start? Because we had this question the other day and none of us could actually answer that question. Is it 11 o'clock or 11:30?
I think it's 11:30, but
Okay.
it's between 11 and 11:30.
We know the food gets there at noon, right?
That's when it starts getting served. Yeah,
Yeah,
I think they get there.
yeah.
But yeah, I think it's the food's targeted to start at noon.
Very
And with
good.
bingo and all these games and everything, so it should be a big pinatas. Should be a big thing. Anyway, so why don't we get started here? Because I think we're all here who are gonna be here for this one.
Super. All
I think so.
right.
We'll give it, well, we'll start, but if somebody comes in, then we'll just stop for a second. But anyway, Yuleni, good morning.
Good morning.
How are you?
Good, how are you?
Good. So, Angie and Yuleni, because I think these are your first interviews here. We call these things interviews, but they're more like discussions and to get to know you a little better. This is for the scholarships, and we've got a record number of applications this year. But we're going to do the best we can. So, Yuleni, tell us a little bit about yourself. This is your what year in college, and where are you going?
So my name is Yuleni Aragon. I am 24.
24 years old? My goodness, you get carded, don't you?
Yeah.
I would hope so.
I'm the eldest of four. I grew up in the track, worked in it as well for a couple years. I wanted a little bit more than that, so I was like, let me try something else. So then I went into the healthcare field. I am currently a medical assistant in an urgent care. So
Oh, yeah?
yeah,
What's
How long have you worked?
Midwest Express Planning.
The one here is the girl.
Yeah, there's one in Cicero, yeah. Yeah. I don't work in that one.
Oh,
That one is
okay.
closest, like 2-3 minutes away from
Yeah.
here. But I actually work in the Room Forest location.
Oh,
So
okay.
like Oak Park, Forest Park, and stuff like that.
Where is that? Like on Lake and
Harlem.
Harlem.
Yeah.
Harlem
Yeah.
and in what, north?
Lake.
Lake, yeah.
Yeah, Lake in Harlem.
Now, Apple, excuse me for one second.
Okay.
Do you hang out at these places? I mean,
Yeah, all the time. I just like to,
You
drive
see.
by. Well, no,
I've never seen you. I've never seen you at the one.
I know. Well, I have a child. I have a 3-year-old, and sometimes our pediatrician and my general doctor are booked. But if I need my daughter to be seen right away, I go to an urgent care.
And you go to that one?
Yeah, which is, I mean, you don't always have to go. A lot of people go to the ER, which I think is unnecessary when it's just like ear infections and stuff like that. Obviously, if you like fell and like had go to the ER, but usually when I think she has like an ear infection or something,
Yeah.
I don't know what to urgent care.
These things are kind of all the rage. They seem to be popping up a lot. And so, geez, I didn't even look at your shirt until now.
Yeah.
Angie, she's wearing a Midwest Express Clinic. You have do you have your job today?
Yeah.
Or are you coming from it,
No, going to.
going to it? So what will you expect on a daily basis like today? Will people come in and I
Okay.
mean, is it,
Dave,
what?
Jesse joined.
Oh, great. Jesse, good morning.
Good morning.
We have, we just kind of informally started here. But we have Yuleni here who just informed us that she works part-time or whatever at Midwest Express Clinic, one of these, are they 24-hour?
No. Basically 8 to 8 Monday through Fridays and 8 to 6 on Saturdays and Sundays. From what I know, it's like the only urgent care that is available and open even on Sundays and late till 6 or 8 on weekdays.
Really? So, and how long do your shifts last?
12 hours.
12 hours?
But we don't work every day. We get like 3 to 4 days out of a week. So
Right.
let's say I work this weekend, 4th of July weekend, but we close at 2. But I don't work next weekend, and I'll be working the next weekend and then the weekend after. So let's say because of school, I'm gonna start going to school Tuesdays and Thursdays. I only am going to be working Monday, Wednesday, Friday, and then if I have to work that weekend, they'll just schedule me Monday, Wednesday, and then Saturday, Sunday.
And so tell us about school real quick. You're
School
going to
is-
where and what are you studying?
I am going to Chamberlain University. It is a just nursing school. It's been hard, I would say, but I have been managing all full-time school, coming here, driving to school. I would say I have been handling everything pretty well. 3.69 GPA at the end of the semester.
3.69
Yeah,
or 2.69
3.
or 1.69?
No, I wish I could do better than 3.69.
3.69 is terrific.
But we're trying. It's definitely been hard, especially being off school for 4 years and then starting all over. So yeah, I mean, I think I've been doing pretty well.
You're also, I believe, in an accelerated program.
Yeah, so it's 3 years. So
Which
it's
is-
like 16 weeks of content or course materials crammed into 8 weeks.
Which I believe those are also a little competitive to get into. Not everyone qualifies to be in those.
I have not heard anything like that with that school specifically, but thank
Apple,
God I
what
got
is
in.
it that you said that she's in?
The
Accelerated.
program means like-
Accelerate.
Yeah.
Yeah.
Gotcha. And like, what do you consider? Freshman or junior?
Sophomore now.
Okay.
Sophomore. Well, it's kind of confusing because it's
Yeah.
only 3 years.
Mhm.
So I'm probably like mid or end of freshman, beginning sophomore. I started last September, we're in July, so maybe in September, maybe sophomore.
And will you get a nursing degree? What do you get out of it?
Bachelor's in Science of Nursing.
Okay.
And then goal is to pass the NCLEX to become a
Pass the
registered
what?
nurse. NCLEX, the
What's
state
that mean?
board certification exam
For
for your actual license as a registered nurse. And then work a little bit, get some experience, and then go back for a master's.
Wow,
I want to become a family nurse practitioner. So that's the
which is
goal.
a person that can prescribe drugs,
Yes,
right?
diagnose, prescribe, treat, establish patients' care.
Better than a doctor because they actually listen to people.
I think a lot of people like nurse practitioners, physician's assistants compared to a doctor. I feel like a doctor.
Why do you
go-
think that?
A lot of people, what we hear at urgent care is that doctors just come and see you, say hi, what's going on, and then they send their nurses to gather all the information. I feel like at urgent care, the nurse practitioners, what I've seen and what it makes me feel like, oh, I want to do that. Like, I want to get that. I just see so many people so thankful for these nurse practitioners. Sometimes they confuse them as doctors, but they're just always walking out all smiling and thankful because they did help them, they did listen. We use this review system at work, and then I can see the reviews, and patients do end up leaving reviews. Oh, this patient nurse practitioner, blah blah blah, did actually listen to me. I felt heard, I felt listened, I felt cared for. So
Do
I
you
kinda
have
wanna-
reviews done on yourself?
Yeah,
You
yeah,
do?
yeah.
How do we get access to those?
Usually most of the time, well, it's like a clinic
It's
review.
internal.
Yeah,
Yeah, okay, I see. It's for the whole clinic,
yeah,
not
yeah.
just for you.
Yeah. So everybody, whoever, like, let's say I triage a patient and be like, hey, if you like your experience, just leave us a good review, and I give them my name and whatever the case was. Yuleni took my vitals, she did pretty well, thank you so much, and then continues with the nurse practitioner. They basically make them rate us from walking in the front desk, the medical assistant who did their intake, and then the nurse practitioner, the PA who did their exams, like that.
So those follow-up texts are important.
Yeah.
Yeah, I get those. I always do reviews.
They're important, but it's okay.
So you start today at what time?
12.
12. And what do you think you'll see? What kind of cases do you think you'll see on a normal day?
Right now, we have been seeing a lot of injuries. We have x-rays.
Injuries?
Yeah, we
So
have x-rays.
a kid skins his knee or?
Most of the time as well, yeah. The other day I had a patient walk in and he walked in normally. And I looked at him and I was like, have you been here before? He's like, no. And I was like, okay, let me just give you some registration forms. Whenever you're done, just bring you everything back. He sits down and then I look at him. He's like bleeding down his head. And I'm like, oh no, give me your stuff. I'm like, give me your ID, your insurance. And I call one of the girls and I have them get help so they can get that cleaned out and stuff. But yeah.
What happened to him?
He fell.
He
I
fell.
think he
Hit
fell.
his head.
Yeah. Either he fell. I don't remember. We're not really supposed to ask them what happened up front.
Oh, is that right?
Everything is just disclosed in the back. I wasn't in the back. I didn't take a look into his chart to see what happened. But either he fell or he probably my guessing now is he probably like bumped his head on something sharp or something.
Yeah.
I don't know. Yeah. So lacerations, our nurse practitioners or our PAs are trained to suture, staple.
Is that right?
Yeah. Injuries, see like broken toes, foot, ankles.
You guys have x-ray machines?
Yeah. we
Is
have a
that right?
tech, yeah.
So it's like a full service thing?
Yeah. We do lab work as well, but obviously since we don't have an in-clinic lab, we have to send it out. It takes about 24 to 48 hours. what else? School sports physicals for kids starting the school year. But yeah, stuff like that. Symptoms, cold symptoms, ear infections, sore throats, headaches, migraines, all the good stuff.
And now that you've been exposed to that by working, are you still happy that you're majoring in what you're majoring in?
Yeah, absolutely. I feel like that's the only thing that, like, being there made me want to like just do more than just being a medical assistant, just taking vitals, giving injections. Like, I want to listen to them. I want to connect with them. I want to help them. I want to be able to be there for them if they need to come back and reassess them or just be there for them.
Jesse and Angie, we don't mean to keep you guys out of the conversation here. You guys have any?
Yeah, well, I'm on here now too.
Becky's on.
That's all right. You're rolling right along.
Well, but feel free to fire away. If you have questions. Good morning, Mickey.
Morning.
Morning, Becky.
Morning,
You-
Apple.
Good morning.
How are you doing, Mickey?
I wanted to catch the girl that didn't want me to interview her yesterday.
Well, she's here and she's giving us medical advice, actually. So you're going to be at where is Chamberlain?
Chamberlain has 3 campuses, one in Addison, one in Chicago, and one in Tinley Park. I currently commute to the Tinley Park one, just because Chicago is Chicago. I don't want to drive to downtown. And Addison, I feel like I know my maps too much. So taking 290 is horrible in the morning. Coming back around the time that I get out is horrible as well, 2 to 3:30. So Tinley Park, I just take 55 and then 80. It's pretty easy, a breeze. I don't mind the 45 drive.
And it's strictly a nursing school?
Yeah.
And how about tell us about your childhood and especially related to the racetrack?
Like I said, I grew up here. Both of my parents, when I grew up, well, growing up, both of my parents worked here.
Hawthorne and Arlington?
Yeah, Hawthorne and Arlington. I think my mom even got to meet sportsmen.
Is that right?
Yeah. And then unfortunately my mom and my dad separated, so then it was just my mom. So I always saw my mom waking up in the middle of the morning, 4 or 5 a.m., having to head out. When I was older enough, she'd like wake me up and be like, hey, like I'm leaving, take care of your siblings, get them ready for school. So I would do that. In Arlington, we would just wake up, get ready, and then wait for the bus outside the clinic, the medical clinic.
Yes, but you were shipped back down here,
Yeah.
right?
Mhm.
That was crazy. Tell us about that. What time did you have to get up?
I don't think I realized how much impact it did on me then,
Yeah.
but I feel like now I don't have any issues waking up in middle of the morning.
So when did you have to leave for that? When would the bus come at Arlington?
Bus would come maybe 5:30, 6 a.m.
Wow.
And then an hour drives, depending with traffic. We would get to school. We would have to start school at 8 a.m. And then we'll probably be there 7:30, make it for school breakfast, and then walk into class.
And then you'd be another hour,
Yeah,
hour and a half coming back
Drive back, yeah.
because the traffic is,
Yeah, we would get home around 4:35.
that's a long day.
How many buses was it?
Back then it was a lot. It was like 5, 6 buses, and then it just started decreasing, maybe like 3, 4, 2, maybe.
And they would go to the whole Morton School District, right? So it
One was
depended.
dedicated to just Morton School District, and one was dedicated. Most of the kids, elementary kids, unless they had assigned schools based on their disabilities. I know some had disabilities, had better teaching at certain schools. They would just drop them off there, but everybody went to Drexel most of the time. So, like 3 or 4 buses for Drexel kids. It was literally from kindergarten to 6th grade, and
Yeah.
then Unity buses for the middle schoolers, and then high school buses for the Morton district. Yeah,
Do you miss Arlington?
yeah,
You liked
Yeah.
Arlington?
Yeah.
It was fun
yeah, it
there?
was fun. The whole town around there was beautiful too.
How do you compare Arlington backstretch with Hawthorne's backstretch?
I think
Be nice.
Hawthorne is definitely home.
Hawthorne's home.
Yeah, I think Hawthorne is home. I felt like Arlington was just like a summer vacation. We got to get away for a little bit, but I feel like Hawthorne is more home than anything.
You guys, I'm trying not to hog the questions here.
I'm trying to, yeah, I missed the beginning of it. I'm sorry about that.
She spoke very glowingly of you, Mickey. It's a shame.
Yeah. If she's lucky, she doesn't even know me.
Everybody knows.
Um, I'm sorry. Let me go ahead and keep talking. I'm
Lenny
not.
is studying to become a nurse, and she works at Midwest Family Urgent Care Clinic. So, have you ever been to an urgent care place, Mick?
Other than an emergency room, no.
Oh yeah, no. These are kind of strictly. We had a little discussion about these places because they're popping up all over, and it's sort of instead of having to go to an emergency room because they're so hectic and crazy, and like we'll when people come in, so I twist my ankle and I want to know if it's broken. How long till I get from when I get in the door till you suppose I leave?
We strive for 45 minutes to an hour.
To get in and out? Wow, that's terrific.
Yeah, most of the
Because you
time.
could be in an emergency room for 6 hours.
Yeah, most of the time.
And I'm sorry, this is what you work in?
Yeah, she's working during and going to school at the same time. And it's very synergistic relative to her major, which is nursing, and that's essentially what she's doing at this clinic.
Do you have any hobbies to keep your mind off of things? Do you relax?
I have a 2-year-old brother at home, or he's 3 now. So I like to teach him stuff. So like his numbers, his colors, his shapes. I don't, since my mom's always at work, or like has to be at work. I feel like when my mom gets home, she's tired, she wants to rest, she wants to eat. So I just kind of like take over and be like, come on, Esteban, let's go draw something. I try to just find out his motor skills. That's one. 2, I like to drive out to meet, visit, see, explore new states, cities. I don't know, I feel like that's just a big thing of me. I like to just explore new states, new
So where have you
areas.
taken your brother?
Esteban, we just took him to the pool recently. He was pretty excited about that.
To where?
Pool. So like a little water park.
Yeah.
We've taken him to community park. We've taken him to the Drexel Park, Safety Park. He loves the park. Just loves the park. He's a little kid. Not much.
I see Esteban a lot with your mom.
Yeah.
Really very
Yeah.
cute.
He's
You
good.
mentioned your one out before. I've only met Alex and Esteban. There's another sibling.
Yeah, she lives in Florida. Her name's Nadalyn. She's 23 now.
Oh, she's a year younger.
Yeah, she's a year younger than me. She lives in Florida. She's married. She has a baby. She just had a baby. She's like what, 3-4 months now. But yeah, it's 4 of us, 2 girls and 2 boys.
I thought it was just
4.
And I kind of missed before. So what year are you in?
September will be my 2nd year.
Okay.
It's a 3-year program. September will be my 2nd year.
Now then do you have to go to nursing school after that?
Not today.
No, after you get done with the 3rd year, I think.
Oh, no, I can specialize in whatever's unit I want. Obviously passing state exam to be licensed to actually be a registered nurse. I can pick whatever unit I want to specialize in, get some knowledge in there, and then the plan is to actually go back again to nursing school for a master's to become a nurse practitioner.
Will you stay within like the urgent care realm, or will you looking into joining like a family practice?
That would be only based on after becoming a nurse practitioner. I can decide either the hospital, a family practice, or an urgent care. I think I'm probably leaning a little bit more into urgent care. I'm kind of familiar to the base, but I don't want to get too comfortable. I want to explore more.
You don't want to get too comfortable on what?
And just going back to urgent care, I feel like I want to expand my knowledge, know more what to do, like how to, like find out how is it going to be in family care or like primary care, or even at the hospital at the ER. It doesn't necessarily have to be a doctor who sees the patients. It could be a nurse practitioner or physician assistant as well. So in between those three, just so I can get a little bit more of a knowledge then. But as after graduating, with my bachelor's, that's when you directly go into the hospital and then pick your unit. Yeah.
Yuleni, before we stray off too far, just because a lot of us haven't been to college in a long time, I just want to clarify that you are going for a bachelor's, which
Yeah.
is a 120 credit hour program,
Yes.
which is effectively a 4-year program. You are doing an accelerated program to finish in 3 years. Am I
Yes.
correct?
Correct.
So I want to clarify that because the scholarships are awarded based on who's going to a 2-year school and who's going to a 4-year school. And so I just want to clarify that you are effectively attempting a 4-year program in a 3-year period.
Yes.
Okay.
Okay, so is this nursing school now, or is that all combined? You might have said that before. I don't know. Or is this just regular school?
It's now. It's a school. My program, my school program, Chamberlain University, does offer to continue your career with a master's as well. So I can just enroll with them again right after I finish my bachelor's.
Okay, and you might have said before, and so if I repeat a question that you've gotten before, just please tell me. Do you plan on in the future staying around here? Do you want to go somewhere else?
I plan to stay around here. I feel like I said, I mentioned earlier that I feel like Hawthorne is home. So I kind of want to give back to this community specifically. Um, I kind of, not to brag or anything, but I feel like I know where everything is here home. I know where the family practices are. I know where the urgent cares are. I just want to sit there and then um give back to the community here. Not just Hawthorne themselves or Hawthorne in here, but Cicero overall.
Well, I think that's nice. That's why I asked the question. That's very nice.
Thank you.
You familiar with what's happening here at Hawthorne?
Kind of. My mom was giving me like a little, I don't think she's very sure about it either, but she's telling me something about the what is it called? The like
Casino?
no, not the casino. She was telling me that the loan was extended or something like
Yeah,
that.
right.
And
So it's
that,
under bankruptcy and they're
Mhm,
trying to
yeah,
find a buyer,
yeah,
but it's either gonna get bought as a racetrack and
Yeah.
things will continue,
mhm,
or it will get bought as a Amazon warehouse or a data center and everything will get torn
yeah,
down.
yeah.
And
Either
we'll
way.
get kicked out.
Yolanda, if you don't mind me asking, what happened yesterday with the mix-up or that you weren't there at the time we thought you were supposed to be?
I thought I had booked for 2 p.m. At the time when I booked the schedule, I was I think it was a different time zone. I'm not sure what the time zone was. I think we were an hour ahead over there. So when I booked it, I thought I picked 2, but it did say like when I set that on the time, it did set Central Time. So I don't know if 2 was supposed to be 1 or 1 was
Dude.
supposed to be 12.
I've done that.
Yeah.
It's easy to do when you're in a
Yeah,
different
me
time
too.
zone when you make a schedule.
Yep. No problem.
Been
I was
there,
just
done that.
wondering what happened.
Yeah, it was a time zone difference. I was like, what? But then when I looked at my email, it did say 1, and I was like, I thought I booked 2, and then in the email it did say Central Time, and I was like, oh no.
Great.
All right, any other questions for Yuleni?
Well, I'm kind of done. Sounds
Yuleni,
very nice and good luck.
Alex,
I bet. Are you guys aware he's joining the army?
we're
Yeah.
trying to talk him out of that.
Yeah, we tried to too.
Why?
Take a
The
look.
army is great.
He's joining
Ask
it.
Chris Block's kid.
No,
Ask my
no,
brother.
no, I know that. It's that the reason that I'm leery about it is that I think he's doing it to help his mother.
Yeah, that's his
And in
only
fact,
medicine.
Yeah, but in fact, it won't help his mother.
Not at the moment.
Right, the way that the rules are set up. So he's trying to get his mother accelerated citizenship, but it turns out that
Oh, for his reasonings, gotcha.
there you go. There you go. No, I'm very pro service, but I'm not, if you're doing it for a reason that's not
Going to actually be effective then.
then I worry about it. But
Gotcha.
yeah, he's helped out a lot. He's a great kid, and he's been in all these programs that we've done, and we think the world of Alex. So you have good bloodlines.
Thank
is the
you.
point.
He needs to talk to the girl that you guys interviewed the other day that wants to be a citizen lawyer, right?
Yeah, yesterday.
Yeah.
Yeah, right.
Oh,
I think
She's
it
still
was
young.
Tuesday
Armando's daughter.
or Wednesday rather.
Yesterday, Armando's daughter.
Yep.
no.
Yeah, she's terrific. Okay, well, you guys, I have to take this call, I'm afraid, but if whatever else, Angie or Jesse, if you've got any other questions, or if you think we've gotten everything
Yeah,
we
I
need.
think that's
I think we're
That's
done.
good.
yeah. It
Yuleni,
looks
what's
like you're
your
about to go to work, so
20 over 80.
I just asked her what a good blood pressure
What
was.
are those? No, yeah, numbers.
Top number is when like the pressure of your heart contracting,
Okay.
and then the bottom number is the contraction release. So it's like the pressure of how much pressure your blood is going through your heart on the first beats, and then the bottom is like the contraction release.
The lup and the dup.
Yeah.
Lupped
Yeah.
up.
Yeah, it's like
Which number would you say is more important?
the top number, I would say.
The top number?
I would say, but medically speaking, the bottom number,
But the numbers are what again?
120 over 80.
Yeah, so don't exceed 120 on the top, Mick, and don't exceed 80 on the bottom.
No, I know all about blood pressure, and that's why I was asking you. She's spot on.
Now, I just took my temperature. What should it be?
98, 97, 98. Yeah.
Very good. Okay. That's my little example. Angie, Jesse, any other questions here?
Yeah, nothing.
no, that's fantastic, and have a lovely day at work today because it looks like you're about ready to go, and
Yeah.
hopefully you don't get any heat sickness or firework burns while you're at work today.
Oh, I didn't even think about that.
Oh, yes, fireworks. It's going to be crazy. So if I come
I've heard on the radio that firework burns are like the number one thing. They're that they're horrible, and they're very worried about it.
Well, they're saying that this year, because it's the 250th anniversary, they're probably going to break a record over how many fireworks are shot over this weekend.
We've had them every single day this week.
If that is fast. But if it's like
Is
a
that
third
right?
degree or like a fourth degree, then yeah.
Yeah, it's been so loud, but luckily the horses here like it. They watch them.
well, buckle up because I think tonight and Saturday
Yeah.
is terrible.
You're working the holiday.
Yeah, I just 8 to 2. Yeah.
Now you do IVs and stuff there too?
The nurse practitioners do. Yeah.
Uh-huh. So that's what when people come in and they're dehydrated
Yeah.
and stuff, you hook them up.
Yeah.
Just remember us down the road when we want prescriptions.
Yeah, for sure.
We're gonna come to you.
she'll prescribe you some Zoloft.
A whole host of things.
Do you guys
So,
prescribe that there?
No, not like
Yeah,
yeah, no, not LPNs.
nurse practitioners, what's that?
MPs.
Oh,
Nurse
NPs.
practitioners. Yeah.
Okay, gotcha. But that's what you aspire to be?
Yes. Yes.
Gotcha. Okay, with that, I'm gonna turn Yuleni loose so she can heal some wounds, take some blood pressures.
Thank you very much.
Anybody else?
Good luck.
Thank you. Take care.
Thanks, you guys. We'll see you at 11 for the next one. Whoever wants
All
to be on.
right.
Thank you, guys.
Thank you.
Thank you.